Good day everyone, I'm Ranjan M. Pangilinan, student nurse from BSN 3H of NEUST. And for today's video, I will demonstrate tracheostomy care. Our goal here is for the patient exhibits a tracheostomy tube and site free from drainage, secretions, and skin irritation or breakdown. And for the equipment, check for For the implementation, first, bring necessary equipment to the bedside stand or overbed table. Then perform hand hygiene and put on PPE if indicated. Then identify the patient and close curtains around bed and close the door to the room if possible. Then determine the need for tracheostomy care. Then explain what you are going to do and the reason to the patient, even if the patient does not appear to be alert, because teaching decreases client anxiety and increases compliance.
Good day po ma'am, I'm Ranjan M. Pangilinan, student nurse po from NEST. Pwede ko po ba malaman kung ano po ang inyong pangalan?
Kimberly po.
Okay ma'am Kimberly, ang ating pong gagawing procedure ngayon ay tracheostomy care po. At ginagawa po ito to promote cleanliness and prevent infection and skin breakdown at stomacite po. So ma'am, let's start na po.
Then, adjust bed to comfortable working position, usually elbow height of the caregiver. Lower side rail closest to you. If the patient is conscious, place him or her in a semi-fowler's position. If patient is unconscious, place him or her in the lateral position, facing you. Then move the overbed table close to your work area and raise to waist height. Then next, check for lung sounds. Then, place the towel below the trachea site, covering the neck and chest of the client. Then put on face shield or goggles and mask. Suction tracheostomy if necessary. If tracheostomy has just been suctioned, remove soiled site, dressing, and discard for removal of gloves used to perform suctioning. Prepare the basins and cleaning solutions. Mix sterile water or plain NSS and hydrogen peroxide in one basin, 50-50 only. Be sure it will fill 0.5 inch of the basin. Then add another plain NSS in another basin that will fill at least half inch. Then next, perform gloving. Then, remove the oxygen source if one is present. Stabilize the outer cannula and faceplate of the tracheostomy with your non-dominant hand. Grasp the locking mechanism of the inner cannula with your dominant hand. Press the tabs and release lock. Gently remove inner cannula and place in first basin with plain NSS and hydrogen peroxide. Let it submerge there for a few minutes. Simultaneously, gently slide the tracheo pad or dressing downward and discard. Then check for some exudates or drainage, skin breakdown, irritation, and inflammation. Then next, clean the inner cannula of the tracheo tube using the prepared plain NSS with hydrogen peroxide and use brush to remove solidified or sticky mucus. Then, rinse using the second basin with plain NSS only. Then, discard gloves and put on another gloves if necessary. Dry the inner cannula using sterile gauze or pad. Then gently reinsert it back to the tracheostomy tube and be sure it is properly locked. Dip cotton tape applicator or gauze sponge in cup or basin with sterile saline and clean stoma under faceplate. Use each applicator or sponge only once, moving from stoma site outward. Pat skin gently with dry 4 times per gauze sponge. Slide commercially prepared tracheostomy dressing or free-folded non-cotton filled 4 times 4 inch dressing under the faceplate. Then check the fit of the tracheostomy collar. You should be able to fit one finger between the neck and the collar. Check to make sure that the patient can flex neck comfortably. Then, remove gloves and assist patient to a comfortable position. Raise the bed rail and place the bed in the lowest position. Then remove additional PPE if used. Then perform hand hygiene. For the documentation, reassess patient's respiratory status, including respiratory rate, effort, oxygen saturation, and lung sounds.